Your baby is suddenly cranky. They're chewing on everything they can get their little hands on, they're drooling everywhere, and last night they barely slept. So you think, yep, it's teething. But then you notice something else. Maybe they have a fever. Maybe they're not eating normally. Maybe they're having diarrhea. And now you're wondering, is this really teething, or is my baby actually sick? This can be surprisingly confusing because teething can cause some changes in a baby's behavior, but not every symptom that happens around the same time is caused by teething. So today, let's talk about the signs that really can fit with teething and the signs that mean you shouldn't simply blame everything on those little teeth coming through. Let's start with the most obvious one. Your baby suddenly wants to chew everything. Your fingers. Their toys. Their clothes. Pretty much anything they can put into their mouth. They may also seem to enjoy biting down on things more than usual. This is very common during teething. You might notice your baby rubbing their gums with their fingers or becoming especially interested in anything that gives their gums a little pressure. And honestly, once you realize what's happening, you may look around the house and think, how did you manage to put that in your mouth? That's your baby exploring and sometimes trying to soothe those uncomfortable gums at the same time. Another very common sign is drooling. Suddenly, your baby's shirt is wet. Then their chin is wet. Then somehow the toy they are holding is wet too. Teething can be associated with increased drooling, and that extra saliva can sometimes irritate the skin around the mouth. You may notice some redness around the lips or chin. Keeping the area gently clean and dry can help prevent irritation. But here's something important. Drooling by itself doesn't prove that your baby is teething. Babies drool for many reasons, especially as they become more interested in putting things into their mouths. So it's better to look at the whole picture. You may also notice that your baby seems more irritable than usual. They are harder to settle. They want to be held more. They may seem uncomfortable when they're eating or when something touches their gums. Mild fussiness can happen with teething. But this is where we need to slow down. If your baby seems extremely distressed, unusually sleepy, difficult to wake, or simply doesn't seem like themselves, don't automatically assume it's teething. You know your baby's normal behavior. If something feels very different, it's worth paying attention. Now let's talk about something parents often blame on teething. Fever. You might hear someone say, "Oh, don't worry. It's just their teeth." But a true fever shouldn't automatically be blamed on teething. Teething may cause a baby to feel a little warmer than usual, but a significant fever can be a sign of an infection or another illness. So if your baby has a measured fever, especially if they're very young or have other symptoms, it's best to speak with a healthcare professional rather than assuming it's teething. And what about diarrhea? This is another one that gets blamed on teething all the time. Your baby is teething, and suddenly their poop looks different. It can be tempting to connect the two. But diarrhea isn't something you should simply dismiss as a teething symptom. If your baby has repeated watery stools, especially along with vomiting, fever, poor feeding, or fewer wet diapers, they could be sick or becoming dehydrated. That's a situation where you should contact your healthcare provider. What about a runny nose? Again, timing can be confusing. A baby may start teething around the same time they catch a cold. So you might see a runny nose and a new tooth at exactly the same time. But that doesn't necessarily mean the tooth caused the runny nose. This is why it's helpful to think about symptoms separately instead of putting everything under the label of teething. One thing you can check is your baby's gums. You may see a swollen or tender area where a tooth is getting ready to come through. Your baby may also want to chew more because pressure on the gums can feel soothing. A clean finger can be used to gently massage the gums. And a cool, not frozen, Teething ring can also provide comfort if it's appropriate for your baby's age and your healthcare provider has no concerns. Avoid anything that could break apart or become a choking hazard. And never put dangerous substances or numbing products on your baby's gums unless specifically recommended by a healthcare professional. You can also give your baby extra cuddles. Sometimes when babies are uncomfortable, they simply want to be close to you. Hold them. Talk to them. Distract them with a favorite toy. Give them a safe teething toy to chew. And keep their little face clean if all that drooling is causing irritation. You don't necessarily need a complicated solution. Sometimes comfort is the biggest thing your baby needs. But how do you know when it's probably not just teething? Look at the bigger picture. If your baby has difficulty breathing, repeated vomiting, a very swollen or hard tummy, blood in their stool, severe or persistent diarrhea, a high or concerning fever, is refusing feeds, has significantly fewer wet diapers, is unusually sleepy or difficult to wake, or simply looks seriously unwell, don't just say, "It's probably their teeth." Get medical advice. And if you have a very young baby with a fever, seek medical advice promptly because young infants need special attention when they develop a fever. And here's the biggest thing I want you to remember. Teething can be uncomfortable. It can mean more drooling, more chewing, tender gums, and a baby who is a little more irritable than usual. But teething shouldn't become an explanation for every symptom. Your baby can be teething and have a cold at the same time. They can be teething and have a stomach bug. Or they can simply be having a difficult day. Sometimes two things happen at once. And that's why paying attention to your baby's overall condition is much more useful than looking at one symptom. So the next time your baby starts chewing everything, drooling everywhere, and acting a little grumpy, take a look at those gums. You might have a brand new tooth on the way. But if something seems unusual, severe, or just doesn't feel right, trust your instincts and get medical advice. Because you don't have to know exactly what's wrong to know that something isn't right. If this video helped you, subscribe for more simple and practical baby care tips. And tell me in the comments. How did you know your baby's first tooth was coming? I'll see you in the next video.